Good evening, everyone, and welcome to our Time webinar for March of this year. In honor of National Women and Girls HIV/AIDS Awareness Day, our webinar today is titled, "What Does It Mean to Be Meaningfully Involved, and How Does It Promote Resilience for Women Living with HIV?" I'm Destiny, the Media Strategist for Seeds of Healing, or SOW, and SOW is an HIV awareness and advocacy organization whose mission is to deconstruct myths that perpetuate HIV stigma. Our work seeks to eliminate disparities for Black women living with HIV. This webinar is being recorded and will be shared on our SoTime platform, as well as posted to our YouTube channel for you to share with others or come back to watch yourself. Attendees are able to drop questions in the chat box and they will be shared. These questions in the chat are not anonymous, but if you want to ask an anonymous question, please use the Q&A feature. And feel free to ask questions and write comments throughout the entire program. Today, we have the privilege of being joined by LaToya Murchison and Bonetta Spratley. LaToya has been living with HIV for 5.5 years, and she's not just a survivor, but has thrived through the process of her HIV diagnosis. She's an advocate and a support system for those who feel discouraged about the battle. Her mission is to educate, inspire, and be a reminder that they are not alone. And Bonetta Spratley is a Black woman living with HIV for over 30 years and has been an advocate working in the HIV community for more than 20 years. Bonetta has rendered services in prevention as well as clinical settings and has a passion for working diligently with those who are newly diagnosed and their families. She thrives with helping the fight against stigma, and she's also passionate about connecting those who are isolated while living in silence with others who share this commonality for a sense of belonging. Our discussion today will be moderated by Dr. LaShonda Wallace, our founder and executive director. Thank you all so much for joining us today. And with that being said, I will turn it over to you.
Good evening. Thank you, Destiny. I appreciate you so much. It is an honor to be here today with you, Bonetta, and with you, LaToya. Bonetta, I think we met has it been about 4 years?
2020? Yeah.
Yeah,
Since 2020. Mm-hmm.
Exactly. And it's been nothing but growth and excitement and nothing but admiration for you since we met. LaToya, you and I believe we met last fall.
Yes, ma'am.
Yes. And the same inspiration. So it's an honor to be here with you. As Destiny started out, she did mention that March 10th was National Women and Girls HIV and AIDS Awareness Day. And we do know that 25% of all HIV diagnoses in the US that do exist are among women. And I would just like to just start off by asking you all, why is it significant for us to have an observation dedicated to women specifically? Any one of you can answer.
Because it's important to get tested at any age, and it allows women to be proactive about their sexual health.
That sexual health conversation is really huge right now, especially when it ties in reproductive health. So thank you for bringing that up, women being empowered. Bonetta?
Yes, so for me, it is significant because women have been disproportionately impacted largely. And if we're going to end the epidemic, women who have been grossly affected ought to be at the forefront to help stop the spread of HIV.
You mentioned disproportionately impacted by the HIV epidemic. And I do know that there are some alarming differences among groups within women. Can you talk to us about that a bit? Specifically, women of color, I'm referring to.
Yes, so as a Black woman, I know that for us, we call what is the Superwoman syndrome. A lot of us take on that identity because it's been a part of our culture. And because I think this is a vulnerability, a lot of people don't pay attention to those things that make us vulnerable to contracting the virus. Instead, we look at the groups of people that we think that contract the virus. And so when I talk about vulnerabilities, and I know I'm shifting from what you asked a little bit, but just to talk about vulnerabilities, because I think that's very important in sharing this information as we observe National Women and Girls HIV awareness. But vulnerabilities being the quality or state of being exposed to the possibility of being attacked or harmed, either physically, emotionally, and the key word is being exposed, right? And so exposure can cause us to be vulnerable, and things that we've gone through in the past, like trauma or anything that causes us not to think sober-mindedly or put ourselves first, or being self-aware of cautions, ignorance to HIV diagnosis, and how it's contracted, poverty, social, cultural, and spiritual beliefs. So those things, for me, when I think about Black women and this superwoman syndrome, those things hit home for me and make me want to share with other women the vulnerabilities of contracting the virus, rather than looking at what they say, those people that we put in the box, people that use drugs and alcohol, people that with prostitutes, or all of those people that we categorize and think that contract the virus. And when we don't look at our vulnerabilities, you count yourself out and you become actually vulnerable to contracting the virus, if that makes sense.
It actually set you up for risk
Yes.
when you are unaware. And thank you for prompting that, because with
Mhm.
that being said, I am actually going to drop in the chat box a pre survey to make sure that our guests, those who are joining us, are aware of their vulnerability. So they're going to do a pre-survey, because as we have this conversation, we're going to learn, right, throughout the discussion. And then we'll do a post survey at the end. So anyone who joined us, whether you are joining us through Facebook Live or you are on this webinar, I just shared a pre-survey and you can do it. The test is actually a simple test. Will take you 5 minutes the most, and it is going to assess your knowledge about your vulnerabilities. But Bonetta, thank you so much about declaring the fact that vulnerability is not specific to a certain group of people. Just like you were, and I think the words that you were searching for, you were saying like sex workers, or
Yes, thank you.
gender minorities, or those who have a substance misuse concern. We understand. We understand where you were coming from.
Yes.
But also the vulnerabilities that you brought up, those social determinants, those barriers and access to healthcare, those hesitance to seek healthcare because of trauma, or the relationships that a client may have with a provider, have put certain groups at a greater disparity to HIV, poor health outcomes. And that was the point that we were hashing out when it came to Black women, what I was saying, because I want the audience to also understand that Black women, just like any other woman, is most vulnerable to HIV transmission by those ways that we're going to talk about. However, we are disproportionately impacted by the epidemic, about 3/4 times our counterparts. And so that is something that we definitely want our viewers and our listeners to be aware of. And so as they gain this knowledge, they use this knowledge to be empowered. So thank you, thank you, thank you so much. So one of our goals is to hash out misconceptions and myths. And so let's shed some light on HIV transmission before we go into the meaningful involvement. How is HIV transmitted or not transmitted? What is it that we want our audience to know on this National Women and Girls HIV and AIDS Awareness Day?
So it's transmitted by having condomless sex with someone who is already positive, right? And that person would have to be detectable. When I say detectable, there's a detectable and an undetectable. If they are taking their medications for up to 6 months consistently or as prescribed, they are said to be undetectable, right? So they are not able to pass the virus on to their loved one, or their, not the loved one, those that they are having sex with. If a person is detectable, they then can spread the virus to those that they engage with condomless sex with. That goes for, you may have to help me with the word, those that use, they switch it up so much. And I'm still used to intravenous drug use, but those that use needles.
We say, or substance use, yeah, products, yeah, to share substances, the devices or the appliances. So it's not always just about IV drug use. There are other material items that people use to share for substance use. I get what
Yes.
you're saying.
Mm-hmm.
And of course, HIV is also transmitted through
Mother to child.
mother to her unborn child, if she's if she happens to have a detectable viral load, or through breast milk as well. What about like kissing or hugging? I'm gonna let LaToya chime in for us.
No, not at all.
Not at all. Okay.
Not at all.
And we have to make sure that we clear that up for our viewers and our listeners. That is not how HIV is transmitted. Yes. So through condomless sex, spread through appliances or products that can be used for substance use sharing, from a mother who has a detectable viral load to her unborn child, and through breast milk. Yeah. And when we say condomless sex, that is the transmission of semen or vaginal fluids. Thank you so much for clearing that up. Last month, I heard an announcement. Well, we all received the announcement for our angel Hadia Brabant, who earned her wings. I came to know about Hadia in this work, but I do know that many of those who fight the cause to end the epidemic were very closely associated with Hadia and had a very, very strong response to her legacy and her passing. Is there anything that you would want our listeners to know in memory of?
She was a beautiful person. She was a fighter. She stood up for everybody. She didn't let it get to her. She didn't let it get her down. And she just fought. She taught me how to fight in this fight of HIV. She gave me the wisdom and the courage to stand out in public and say that I'm HIV positive.
What legacy does she leave behind in regards to the advances and progress that we've made since we all first learned about HIV? Bonetta?
Thank you, LaToya, for speaking so many kind words about her. The legacy that she has left is that listen, we can live when having a positive diagnosis, and that you don't have to just be a patient, right? You can learn to advocate and fight for yourself and others. you can stand in the face of stigma, right? And dare to live and to thrive and to make, the best out of what was a bad situation, because HIV is no longer a death sentence like it was in the 80s and the 90s. And she did a remarkable job advocating, representing the Black women and a person living with HIV overall. And I appreciate the work that she did. I appreciated her stance as they call dandelions. Um, yeah, she made a mark, and she will be forever remembered.
Thank you. Thank you. I believe that this is our first webinar that we've had since we learned that news, and thank you for bringing those thoughts of sincerity. So now that we have cleared the way and got some of the basics shared, we are here to learn more about meaningful involvement for a person living with HIV. Who can define that? What exactly does that mean?
For me, being at the table, making decisions,
Mhm.
whether they be policies, funding, services, research, or initiatives. So things that affect us, people living with HIV, we termed it nothing about us without us,
Mm.
right? So anything about us, no decisions should be determined without us. That's what meaningful involvement is for me.
And for me, it's making sure that we are all equal partners, like Bonetta said, in the decision-making process, and that we have a seat at the table.
Yes. So somebody's going to make a policy or make a decision about how you access healthcare. You want your voices to be heard, right?
Yes,
Absolutely.
ma'am.
Absolutely. When did you all come to learn about, being encouraged or advised to be meaningful involved? I heard you, LaToya, say that you learned about your diagnosis like 5 years ago. You've been in this fight. And Bonetta, I know that it's been a couple decades for you. But when did you learn about being active and proactive to be meaningful involved? And what did that look like when you started out?
Well, I learned last year doing another webinar about being meaningful involved. And for me, what I've been doing is sharing my story with others. I've put on webinars, I've had seminars in my church,
Mm.
and I continue to share my story and information about HIV. And I go to different conferences. I've been a presenter at a conference, and I'm hoping to be another presenter this year.
Now, one of the things that I heard you mention, LaToya, was your church.
Yes, ma'am.
Right? And faith and HIV is a common discussion, right? The intersectionality of faith. Some people have had their strength and their courage through their faith. And then I've also heard, other sides where sometimes people feel marginalized when they are in a house of worship. Can you give us the possibility and the hope, and what is the expectation of faith when it comes to learning about HIV in the house?
That they accept you for who you are and not treating you any different. Because for me personally, HIV is just like another kind of illness that I have, which I have several of. And I take my medication. But as far as like with my pastor, when I went and I talked to him, he's the one that pushed me to speak publicly about HIV.
Awesome. And Bonetta, I know that since I've met you, I know that you have taken several opportunities to enhance your experience as an expert, not only about HIV, but as an expert with advocacy. And sometimes when we think about doing webinars and sharing knowledge, sometimes people envision, oh, it's a person that have alphabet soup behind their name or multiple degrees and so forth. Having lived experience, that being your content knowledge that you expound upon, how has that been for you in this space, in this arena, for a person with meaningful involvement?
So, well, let me just say that since I've been diagnosed, it's been over 30 years, right? I was diagnosed in 1990. So I've been pretty much meaningfully involved, but we didn't have a name to put to it,
Mhm.
right? So I really didn't come into knowing about being meaningfully involved until about 2010 or 2011. So I'm from Virginia. I moved to South Carolina in 2009. But when I began joining women's groups after moving to South Carolina, also a lot of training was taking place because people living with HIV were being said to be living longer and healthier lives and losing their Social Security. And there was also a growing concern that the decisions that were being made about us were not coming from us. So some of the training was on the importance of advocating for ourselves, forming CABs, which are community advisory boards, to voice our opinions and help make decisions at local levels, whether they were at aid service organizations, community-based, or at the health clinics. And then it moved to federal level with policies. So I've been involved at each point that I've just shared. And it's been it's been a ride. It really has been a ride. It has been truly for a person like you said that does not have a degree. Um, I've had positions that needed a person or required someone to have a degree, but because of my lived experience, right, I was able to um, be placed in that position. So, and I laugh with my family sometimes because I haven't applied for a job in over 10, 15 years. Like people seek me out and ask me to um, be a part of their organization or um, organization or health clinic. And so it has been quite good for me. I've made a career out of it, was able to raise my daughters with it. So the benefits were really good. And of course, now I am um, you know, adding to my professional development, taking courses and stuff like that. But earlier on, and still today, people living with HIV with lived experience, it's really a hot commodity in the HIV
What
community.
is the difference that is made by being at the table? So now that you're at the table, they're talking about policy, they're talking about access to health care. When you arrive, what difference does a person with meaningful experience make by being at the table? Because we know that there can sometimes be people in the room, but all voices are not heard. So what is the difference does it make when you are at the table?
So for me, our voices are heard. We get to share what works, what we know is proven to work. For me, it gave me a lot of education, what happens behind the scenes. Like, for us, we go to the doctor, we're seen just like any other doctor you may go to. They ask you how you feel, you get your prescriptions, you go home and take your medications. But behind the scene, there's a whole bunch of moving parts to make the HIV community what it is. And so I've been able to, voice my opinion on what works and what does not work. And as things have changed over the years, our lived experience and us speaking up and speaking out has helped make a difference when we share with those persons that were in leadership. It had also gotten us strong enough to take on those positions.
Mm.
And now we're the leaders. There are a lot of people that I know have their own organization. They're in executive director positions and stuff. And so it has done some great things for a lot of us. And I don't want to make everyone think that everyone that has been diagnosed is uneducated or don't have, some great background, educational background, because it's not like that. But for me, I didn't have the education, but my lived experience and my willingness to be at the table and to share my lived experience, to live out loud, has afforded me to be a part of those moving parts.
Mm-hmm. LaToya, what
Yes.
lessons have you learned from being in these spaces and places and being meaningful involved? Is there any light that was shed or anything that you learned that you did not imagine before you got involved?
I learned that I don't have to sit in the background anymore, that I can be out front and people will accept me for who I am, not just because I have a disease.
Mm-hmm.
Because before, I always sat in the background doing everything. I would never be out front. I didn't want to be a leader.
Mm-hmm.
But now that I'm learning more about meaningful involvement and about this movement, I want to be out in the front. I want to be that person that you see that speaks up.
Mm-hmm. Thank you. One thing that I learned from you when we first met, and I still remember and I appreciate you for, was when we were sitting around and having breakfast during the
Mm-hmm.
retreat, and you checked in on me and asked how was I doing, how was I coping and handling the events, and that is something that I expect and something that I received from someone who is a leader. And I just want to take the opportunity to thank you for that, because you definitely showed up for me.
You're very welcome. Thank you.
Yes, yes. So specifically, what have been your contributions? I heard you mention, LaToya, about doing some things at your church, going to some events, participating in webinars. What other ways have you contributed, LaToya and Bonetta, meaningful involvement?
I've written books that I share about HIV. I include resources and different organizations that you can reach out to find out more information. I share my story and I give you ways to connect with others.
So for me, I've been a medical case manager at a federally qualified health center. I've been a medication adherence counselor where I worked with you know, patients to adhere to their medications and help them to um, prioritize um, their lifestyle and to incorporate taking your medications, because it's not as simple all the time to just start taking a medication. And it's so many different things that take place in people's lives and stuff. And so just giving them tools to use in order to get them on track. I've also led HIV one-on-one trainings in the earlier years um, at local, in the community and at local jails. Of course, shared my story. That was my entry point into the HIV community, at women's shelters, schools, colleges. So I've done a host of things, and now I'm working at Seeds of Healing as the program coordinator. And I have the privilege of being the moderator over a human interactive platform. And it's a social media-like platform where Black women can come and network to combat isolation and loneliness. And so I also plan the annual retreat that we have every year. And so I've done a host of different things. I've worked on coalitions to help modernize HIV criminalization laws. Oh my goodness, it's so much
Well, you know what, Bonetta, don't.
Sometimes it makes me want to cry because I've done so much, and
Yeah.
you get so lost in the work that you're doing, and you don't always recall, you don't get a chance sometimes to take a breather to look back at all of the things that you've been blessed to be involved with. And so many people didn't get this opportunity. And so yeah, it's good to be able to take a trip down memory lane sometimes.
Well, you don't put your resume out there. Now, I hope don't nobody try to come and get you, because we're getting used to you at Seeds of Healing. And yes, everything that you do, and as well as what LaToya was mentioning, putting your passion to purpose, it makes a difference in the lives and the programming for those who are impacted. But I'm just curious to know what actually made you decide to become meaningful involved. I know that sometimes people are hesitant. People don't want to be the poster child for certain circumstances, especially those such as HIV that can be greatly stigmatized. But what made you decide that the time is now and you wanted to be meaningfully involved?
I didn't know anything. So, like I said, I was diagnosed in 1990, and I had no idea about stigma. In fact, because of my lifestyle and the things that I was involved in at the time, like I was a whole badass, and so I wouldn't have probably cared anyway about the stigma. So I just started telling people about my diagnosis. I had been diagnosed, and by the time I found out about um stigma and how people felt about people living with HIV and the fear behind um being in close proximity to people living with HIV, the cat was out of the bag. And so my case manager, my second case manager, because things had started to change. But anyway, my second case manager was a pastor, and she had a HIV ministry in her church. And so she asked me to work for her. But before she asked me to work for her, she would try to get me to lead the women's group that she had. And so, I mean, it started in small bits and pieces, and then I would work and go to the consortium meetings in Virginia with her. And that's where it started, and it just grew, and here I am. But those small things helped me to grow into who I am today. And I didn't. We were talking before coming on here, and I wasn't afraid of anything back then. And it's like now all of a sudden I'm paying attention to a lot of things, and I get nervous when being before people, or speaking engagements or facilitating and stuff. I don't know what that's about, but anyway, yeah, some things are shifted. I'm gonna have to figure that out. But I'm continuing the work. I like what I do. I know that I make an impact, and I've done it for so long. Um, yeah, it was meant for me to be doing this meaningful work that I do.
So, LaToya, what about you? What made you think that the time was now to become meaningful involved?
because no one knows my body but me, and
Mm,
no one can speak for me but myself.
mhm,
And if I don't stand up and speak for me, how can I expect someone else to?
mhm,
And I also want to be able to be a voice for those voiceless people that can't stand up and speak for themselves.
mhm. Did you have any fear or hesitance when you decided
No,
to
ma'am.
start to do? No?
No, ma'am, not at all.
Mhm,
Once I had that conversation with my pastor and he pushed me into putting on my first program for World AIDS Day, I just kept going. I never stopped.
mhm. And we are so grateful to have you here.
Thank
I
you.
know that um, there's a lot of champions that are doing this work.
Mhm.
It can be considered advocates, role models, heroes. Um, I'm not certain what title you would probably want to give someone, and I don't want to start mentioning names because I may miss someone, and everyone deserves to be honored or recognized. But is there anyone or anything that you know contributed to you being outspoken about advocacy for HIV and AIDS?
Again, for me, my pastor was the major
Hmm.
part of me standing up. Because, like I said, I always been a person that sat in the background and did the work for a while everybody else talked about it. But when I had to put on that first program for World's A Day, I couldn't depend on anyone else to do the work. I had to do it for myself.
Mm,
And that made me stand tall, made me hold my head up, and it made me speak out. And ever since then, like I said, I've just been going ever since. And I'm thankful for him pushing me to do that. I can no
So,
longer be quiet, as they say. I'm sorry, Bonita.
nope, I jumped in before you were done. I'm sorry. For me, like I literally have a list. I'm not gonna go over the list, so don't worry. But I can sum it up saying that each person that took a chance with me, that
Hmm.
gave me an opportunity to be in the spaces that I talked about earlier, where I said that most of the positions that I held needed a degree and I don't have one. Like they took a chance with me. And I know that it was a divine appointment that I be in those spaces because even though I may not have had a degree to hold those positions, like I had the lived experience to touch the lives of those that I encountered and make a difference in their life, even if it was to know that there is life after a positive diagnosis, even if it was I can I can live. Um, this is not the end of the road. If I take my medications, I'll be okay. Um, I have someone that I can talk with because I had an open door policy. Like you could call me any um time of the day when I was at work. And so it was those uh moments that um let me know that I was in the right place doing what
mhm,
I was supposed to do. But yeah, I do have a long list, and
mhm,
I always think of those people and think that if they were not in the place that they were, like they opened the door for me to let me in to do what I needed to do in those moments.
mhm.
And I appreciate them all, even you,
Well, thank you.
even you. Thank you.
I just wanted to
Yeah.
say that I remember on the final days before um, my mother succumbed, um, she actually spoke to me and she said, "Okay, LaShonda, I'm ready to tell my story." And the reason why she said that was because she had got to the point where she was very ill and not well, but the years before that, I would always say, "Mom, come on, let's go to a group." I heard about we were living in North New Jersey at the time. There was a place called St. Clair's, and I kept saying they have a group for women. You can go, you can get help, you can meet other people, and feel comforted or ask some questions. And it wasn't until she said, "I'm ready to tell my story." Um, and her reason was because she did not want anyone to go through what she went through. So a couple days later, my mother did succumb, and I was a nurse. It was not until 2013, 14, where I actually told her story through Seas of Healing. And I just want you all to know that I know the difference that your stories make in the lives of those who need to know that there's no one to blame for a diagnosis, that there is effective treatment, and that privacy is different from secrecy. People are entitled to their privacy, and stigma is a thing, and it gets in the way. It gets in the way, but it is fueled by not having factual information, misconceptions. And thank you both so much, and everyone else who is a champion in this field that stand in the gap for those who feel silenced, um, impacted by this epidemic, including their loved ones, because it was not my role to say or speak her story until the permission was given. So thank you. And I want anyone who is on the webinar with us, you can feel welcome to leave comments or ask questions, because we will make sure that we summarize that before we get off the call. Someone from Facebook mentioned that it takes boldness and bravery to share your story in advocating for women like myself. That was the comment that the individual left. And someone else said, "Thank you both ladies for sharing. It takes boldness and determination and courage for women like me." So they mentioned it in both places. So thank you. Are there any programs or that you would like to highlight or let the community know about that is actively doing meaningful involvement with those with lived experience, that can be referenced, that we want the community to know about?
Well, there are a lot of organizations and programs, but most organizations, most aid service organizations, or organizations that have programs that cater to people or support people living with HIV are open to and have begun to incorporate meaningful involvement positions, because it's a plus when writing grants to show your organization's involvement with people living with HIV and how you incorporate them in the decision-making process.
Mhm.
So yeah, I would say yeah, any and all of those organizations.
Do you, well, I was asking, did you know of any organizations that would be a good example that could be referenced? Are you familiar?
Seas of Healing.
We know who you are. We know. Um, but we are, for our viewers and listeners, we are in the Southeast. We are in North Carolina, Southeastern North Carolina. But, you know, we have a nation full of organizations. And we do want to uplift and support those and reach out to those and reference those that are doing great work with meaningful involvement. And so I was just curious, and that was why I asked. LaToya, are you familiar with any organizations that the community should know about?
Well, I just had the same conversation with my support group last night.
Mm-hmm.
And some of the names that we came up with were the Cero Project,
Mm-hmm.
Thrive SS, PWN USA.
Mhm.
Those were some of the ones that we came up with.
Yeah, Sister Loves, Southern AIDS Coalition, the National Minority AIDS Coalition. I mean, it's so many.
Okay. The Well Project.
The Well Project.
Yes, exactly. Right. See, y'all know them. Y'all know them. They
Yeah.
out there. And you know it because you're involved, right?
Yeah.
So the common folk that is not involved, they probably would not know. But now, since you highlighted it, we all know. Thank you for mentioning the Well Project, because the Well Project members have actually joined us, I think, in our first Think Red ILM, and we have a couple other involved members with the Well Project. Wonderful, wonderful.
And can I just say, listen, I've been connected to so many of them. Please forgive me if I did not call your organization or your program, because people gonna be like, nah, she ain't called this one, or she didn't. But yeah, I don't like to call names.
Somebody said drop the organization
There's
name
so many
in the chat. Drop the organization. We're gonna do you one better. If you signed up for this webinar, we got the email list. We can send the list to you all. And then we'll make sure we'll follow up, and we're gonna leave a list on our social media sites, because if you are in the region or if you can benefit from any of those organization programs, we want to make sure that you are connected. You are connected.
U.S. people living with HIV caucus. Like they all come into my mind now.
They all coming to your mind now?
It's so many of them.
Yeah.
Ribbon Consulting.
Okay. There you go.
Yeah.
What advice would you give someone who is considering to become meaningfully involved?
Take your time and make sure that it's something that you really want to dedicate yourself to. Do your research so that you can be more informed and giving out the correct information, and get involved in your community and connect yourself with other people in the movement.
Yes, very good. So yeah, know your contribution is needed. Look, know your worth as an individual. Don't let HIV define you. And use it to your advantage to bring about awareness. We all have our own individual stories and lived experience that we can share with others, that we can make a difference in their lives. We can prevent the next person from becoming HIV positive, becoming part of the statistics. So yeah, you don't always have to share openly. I tell people sometimes there's so many different platforms to making HIV community work. And I'm not a big policy person, but I'll make the signs. So, you can do stuff behind the scenes until you can feel comfortable, if you want to later on, to live out loud and take some of those boots on the ground type position.
So our sister Alicia said, and I'm just mentioning her name because she is one of our proud board members, who is heavily involved in this fight. She said that the international community of women living with HIV, that's a new one for me, Alicia. And she also encouraged that someone get a mentor within your network if needed, if you decide to get involved. So thank you for those bits as well. Thank you, thank you, thank you.
Yeah.
I want to ask, what is on the horizon for you as a person who is meaningfully involved? What should we expect? What's to come?
I want to turn my initiative, Toya's Quiet Storm, into a nonprofit so that I can help people in my community, because right now we don't have any type of organizations or any type of help in this community, and I want to be able to help others so they don't have to go through what I went through.
And where are you at exactly again, LaToya?
Southern Pines, North Carolina.
Oh, Southern Pines. All right. That ain't too far.
No, ma'am.
All right. Well, I just want to let you know that if there's anything that Seeds of Healing can do to support you with that endeavor, do not hesitate to let us know so we can always follow up on that.
Thank you.
You're welcome. Bonita,
Uh,
what you cooking up over there? What you got?
Listen, opportunities are always popping up. Outside of doing the work that I'm doing at Seeds of Healing, I'm taking a community health worker course and a mental health first aid course at Durham Tech. I'm also contracted with two other organizations who are working on new initiatives that want people living with HIV's insight and perspectives on. So doors are always opening, people are referring you, people are always looking at you when you don't know. So I'm just ready. At one point, I thought I was going to be passing the baton, and Seeds of Healing came. And so I'm back in the trenches, and I'm rolling until I can't roll.
Yeah. But thank you both. I appreciate you for just being transparent, telling your story, encouraging others, and most and foremost, being meaningfully involved. We posted a post survey in the chat for those of you who did the pre-survey, and possibly you learned something that will impact your perspective or anything that is stigmatizing, or maybe you just learned something that gave you some more facts and awareness about HIV transmission. So take the opportunity, and we'll also do the same thing on our Facebook post. We'll make sure that the post survey is posted. So last, I just want to say again, we're grateful to have you here, and we hope that everyone enjoyed the webinar. If there's anything else you want to say in closing, please feel welcome to do so.
No, I have nothing.
Thank you for
No, I have nothing.
well, thank you for having me and considering me for this opportunity. I very appreciate it.
Thank you for being with us, LaToya. We know that this will
Thank
not be the
you.
last time we will all be together again.
No.
All right.
Yes.
Well, we hope that everyone have a good night and that you enjoyed the webinar. Take care.
All right, good night.
Good night.